Hi everybody, it's Bert with First Time Mom here. I am a blogger and a mom of 3, and you are watching my weekly show called First Time Chat right here on Facebook on First Time Mom MN. So you can go and visit our website, or my website. My sister contributes, so that's why I say our. But you can go and visit our website at firsttimemommn.com, and there's tons of information out there if you guys love us, if you love us and you want to see more about us. So anyway, I am going to talk to you guys today about a topic that is very near and dear to my heart. May is actually Maternal Mental Health Awareness. Or I think it's actually Maternal Depression Month, but there are quite a few different mental health things that come with being a mother. And so May is the month that people are trying to bring awareness to to the cause and to what moms sometimes have to deal with, because it is often a disease that is suffered a lot in silence. There's a lot of shame that is associated with it. 2 weeks ago, I talked about my story and postpartum depression. And so today we are going to be talking about what to look for. And friends and family members who might be watching this, we're talking about what you should look for too. Because oftentimes the mom who is struggling with postpartum depression does not realize it on her own. So that's why she needs a support system surrounding her to let her know that maybe something is up. So this I don't know, I was going to say this episode, but this show isn't meant to self-diagnose by any means. If you think you do have postpartum depression, or you're struggling with postpartum depressions, please go and see your primary care physician or your OBGYN or your midwife. Go and talk to a medical professional to receive a proper diagnosis. Please do not try to self-diagnose just because you're watching me, because I'm by no means am I a doctor at all. So if you think that this is a show that your friends and family really should watch and see, I just want to encourage you all to share. You can just click the little things that say, react to this. So click share and share it with your friends and family, and then we'll get started and it'll be totally fun. So, I have not worked out today. That is why I look like this. I threw on some lipstick, and which I'm hoping I don't have any on my teeth. I did at first when I first put it on. But anyways, so yeah, I have to go and work out after this, which sucks. My alarm went off at 5. I typically am I'm the kind of person who likes to work out in the morning, first thing in the morning, so that it's not like hanging over my head like it is right now. And I decided to sleep today because I've been getting up at 4:30 every day. So I'm going to take a drink of my coffee because for some reason I'm like super duper tired. Maybe it's because I haven't worked out. I don't know. Who knows? So, but I see some of you are joining in here. So I'm just going to, just going to sit here and talk for a little bit. Veronica, thank you so much for sharing the video. I really appreciate it a lot. So, and we have some of our regulars who are already in here. I really appreciate when you guys come and like sit and chat with me, because sometimes it feels like I'm on an island talking to a screen by myself. So, and Emily Tofty, well, now she's Nestival, but Emily Tofty, she was my best friend in 3rd and 4th grade, and she just had a baby yesterday. So congratulations, Emily. Yay! I'm going to see, I don't know if anybody's commenting, because I may be having, yeah, people are commenting and I don't know. Thank you, Facebook, again. So we're going to do this. Whoa, 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 whoa. Okay. I'm watching my own thing. Again, Facebook, I did not see who had joined, but Marnie's here. Hi, Marnie. Thank you for joining. Laura is going to go. Laura's my sister. She's going to go multitask. So let's get started. Those of you who happen to be folding laundry, multitasking, you don't really have to listen to me. I don't think there's anything special. I'm not going to be showing you anything that you need to see today. So you just go and do your own thing and you can listen to this. Facebook is weird sometimes. That is correct, Veronica. Super weird. It was totally fine last week and now it's not fine. So anyway, so postpartum depression, otherwise known as, so the medical term for it is perinatal depression, meaning during pregnancy and afterwards. They decided to change the term because not a lot of people understood what perinatal meant, and so it is called maternal depression. And let's see, Ashley says she's listening. Ashley, thanks. Thanks for even listening. I appreciate it. Ashley's one of our longtime viewers too. I hope things are going well having your hubby. I'm assuming it's your hubby, having your partner home from being deployed. That was the topic of conversation for a while for us with Ashley. But now her special person is home with her. So she is picking up kids and she's not going to be commenting much, which means I'm just going to be relying on all of you to do more talking. That's right. Ashley's not able to talk, and so it rests on your shoulders. I'm just kidding. Or am I? So anyways, maternal depression affects 1 in 4 North American women. That's right. 1 in 4. So 25%, it affects 25% of us. So chances are you know someone or will know somebody within your lifetime who will struggle with maternal depression. So there are 4 types of maternal depression. There's the baby blues. That is the baby blues happens within the first 2 weeks after delivery, and it does not last past 2 weeks. So about 80% of mothers will experience the baby blues. So, and it's just hormones fluctuating and your body trying to figure stuff out. But some symptoms of that are exhaustion, crying, sleep problems. I mean, some of these are kind of, it's really hard to look for symptoms and know if there's something wrong because as a new mom, you're exhausted anyway. You're having problems sleeping anyway because your baby is getting up every 2 to 3 hours. You're crying a lot, especially if you're a first-time mom because you left that hospital and they just gave this kid to you. They had like no concerns about whether or not you could take care of this child. Like your time was up and you went. That is how I felt when I left the hospital with my son, my oldest. My husband and I were like, oh my gosh, they just left me. And I had a lot of problems breastfeeding. And so I relied on the nurses every single time he had to eat. I pushed my call button and I was like, please come help me. I don't know what I'm doing. And they just let me leave with him. And that was very scary. And so I cried a lot. I cried so much. Let's see, I'm reading some of the comments here. So Ashley Roberts said she had terrible postpartum depression. Ashley, how many kids do you have? A lot of us do. I did. I am still on antidepressants to this day. I talked about this 2 weeks ago. When I talked about depression, I have no thoughts of going off of them because for me, it's just not necessary. If it ain't broke, don't fix it. I'm a healthier and happier person on antidepressants than when I wasn't. So, and Katie Leibold. So Katie, thank you for sharing. I saw that you shared. I appreciate it. Katie cried. She said she cried for 2 weeks and she was so sad. And that's the baby blues. So that is what I want you guys to pay attention to in regards to the baby blues. So 80% of women are going to experience symptoms of the baby blues. The difference between the baby blues and maternal depression is that the baby blues stops at a maximum of 2 weeks. 2 weeks, that's it. If you are still feeling those feelings of sadness, exhaustion, having difficulty sleeping, kind of just this hopeless, not being motivated, kind of attitude, that could possibly be postpartum depression or maternal depression. And Emily, who's my friend from 3rd grade or 2nd grade, were we in 2nd grade together? I don't think we were in 2nd grade together. Anyway, Emily said, I had postpartum depression with my first one. I feel like we mamas don't have a chance to talk about this enough. And we don't. And that is exactly why they have created this national movement for the month of May. That is maternal mental health awareness. And that is what the month of May is. So that more doctors are paying attention to this. More women are opening up and talking about their experiences. And that's why we're talking about this. And that's why I'm talking about this. And Ashley said, I have 2. She has 2 kids. With both my pregnancies, I was in the hospital due to complications, and they were both preemies. And that, if you have a child who is sick, or was born prematurely, your risk of developing postpartum depression is significantly higher than a mom who has had a normal, full-term pregnancy. That is the truth. So those of you who are watching this who may have, just be aware. I think that is what I want for us to talk about, and that's what I want for, I hope that you guys share this with your friends and families who aren't parents so that they can be on the lookout for you. Because chances are, and I talked about this 2 weeks ago, you're not going to know that something is wrong. You may realize that something is going on. Terry, and I want to talk. So Terry at Tunes just said something, and I am going to read it. But you might know that something might be wrong, but it's an illness. It's a disease of your brain, and it messes with your reasoning. And so 9 times out of 10, you're not going to be like, I think there's something wrong with me. Like, nobody's going to say that. That's not what we think, So Terry said, I've had anxiety, depression during pregnancy this time around, which I did not have with my other 2 pregnancies. I'm so worried about postpartum depression afterwards. Thank you for talking about this. It's so important for women to talk about, and it is so important for women to talk about. And I think that we need to spend time talking about postpartum depression and understanding what it is, but not being afraid of it, because we have the tools and the resources to help each other. And we're not living in the 1800s where we may have spiraled off the deep end and had something like postpartum psychosis, which is very extreme. But it's a very real illness if postpartum depression goes on long enough and is undiagnosed. So really, I don't want you guys to be scared of this. I think that we need to be open to the fact that, pregnancy does a real number on our body and on our brain. Hormones are powerful things. And if we are not open to the possibility that something might be wrong, then that's when we get ourselves into trouble. So Laura said, I think one of the things that makes it hard for moms to see their depression is that we assume motherhood is hard and we have to suck it up and deal with it, which is a big fat lie. And it is. So, I have fallen into this category as a blogger of kind of perpetuating that I didn't know motherhood was going to be so difficult. I wrote a blog post and that was the title, and it went viral on Huffington Post. And it is really hard, but the truth of the matter is women have been doing this for thousands of years, and they certainly didn't have all the contraptions and technology that I have today. And so even though motherhood is really, really hard, there is a difference between recognizing that it's hard and recognizing that it's sucking the joy out of life. And if it's sucking the joy out of your life, then that is not sound and reasonable thinking. That is depression talking. So I'm going to move on. But yeah, so mood fluctuations, anxiety, that also comes with the baby blues. But the key, again, with the baby blues, everybody say it with me, the baby blues last for how long? 2 weeks, maximum 2 weeks. If you are still feeling hopeless, if you are still lacking any sort of motivation whatsoever to do anything, chances are it could be depression. Don't wait for it to get better. If it goes past that 2-week mark, go and talk to your doctor. I waited for 4 months with my son. I just kept thinking it was going to get better, and it just kept getting worse and worse and worse. And this is what Laura said. She said the worst thing, Laura had developed postpartum depression with her second child. And Laura, for those of you who don't know, is my little sister. So Laura said the worst was having my precious baby smile at me, and I struggled with smiling back. And that is what it is. So again, 1 in 4 North American women will experience postpartum depression. So this is real, guys. It's real, and it happens. But we do have the resources to make it not as challenging or hard. I'm going to move this light a little bit. I feel like it's kind of weird. Take a drink. So some feelings that you may have if you have postpartum depression, or some actions, behavior that your friends and family may notice. Negative feelings towards things. And those are long lasting. So all of these are long lasting. It never goes away. Anxiety, unexplained concern over baby's health. This should have been such a tip off to my husband and I. I was thinking about this today. When my son was 6 weeks old, I was nursing him, and he had a huge spit up, and I think I don't know if it was throw up or if it was just spit up, but he spit up all over me. And I took it to the extreme of, oh my gosh, our child is dying. I have to bring him to the hospital. You have to let me go. I am going to the emergency room. And I put him in his car seat, and I was ready to leave with him. And my sister-in-law, who was stationed in England and visiting us, happened to be there. And Ben, my husband, and I are having this huge blow-up fight because I am insisting that he is not going to let me save our baby, and our baby is dying. And he's like, Bert, he spit up. It was spit up. Like, what are you talking about? And I'm like, no, he is dying. You are preventing me from taking care of my baby. You. He wasn't. And he was fine. And he was totally fine. We laugh about that now, my sister-in-law and I, about when I was crazy, when she was at my house and she saw me being crazy. But yeah, so unexplained concern and anxiety over your baby's health. and well-being. You just, or anything that you can't control. If you can't control it, you're going to feel extremely anxious about it, and it's irrational and it doesn't make sense. Like, my baby spit up on me, I have to take him to the emergency room immediately. And you bastard husband, you get out of my way because I'm going to save our baby's life. I mean, that's seriously, that's what I was thinking in that moment. I was thinking, my husband doesn't care, our child is going to die. And he spit up. He spit up. It was a profuse amount of spit up, but still, it was spit up. Oh, Ashley, don't cry. I don't want you to cry. Don't cry. And Tiffany said, let's see. Tiffany says, I cried every single day for a month thinking it was normal, the way she was feeling. Then I felt angry for 3 months and didn't understand why when I had my beautiful baby girl. When I was getting mad at her for no reason, I knew that something was wrong. And that actually brings us to our next our next symptom. And this, I think, is the key to recognizing postpartum depression. Hostility towards your baby. It is real. It is a very serious symptom. And this is when, I think when you're in the beginning stages of postpartum depression, you're not at that point where, like, maybe postpartum psychosis gets, where, you're confused, disoriented, you might even hallucinate. Some of the moms that, do you remember in the 90s, there was a woman who drowned her babies, her children? She had postpartum psychosis. It was undiagnosed. She had classic textbook symptoms of postpartum depression. It gives me goosebumps thinking about it. But she had classic signs, but nobody said anything. Nobody did anything because for such a long time, we didn't talk about this. And she wasn't in her right mind. She didn't want to kill her children. What mother wants to kill their children? They don't. But that's how serious this disease is, and that's what it is. Cancer kills, and depression can kill as well. And it's not going to get any better until we actually talk about it. And now Kendall needs me. Yes, Kendall? I have held off on watching TV all day for them so that they could watch right now. They're probably hungry. So let's see. Ashley Roberts said, my son had startled and I thought he was having a seizure. I took him to the ER and got laughed at. Unexplained anxiety over the health and well-being of your child. That is that's a symptom of postpartum depression. Another symptom, extreme guilt. That feeling that you're not good enough, your baby would be better without you, you just are going to screw this child up, and then feeling bad because you're feeling those feelings. And it's just this very long-lasting, almost permanent feeling of hopelessness. That is what depression is. It's you feel hopeless. Yes, Kendall? Oh no. She saw a wasp. Which is actually probably a yellow jacket and not a wasp. So another symptom is exhaustion, which, like I said, most mothers feel exhaustion, especially if you have a newborn or if you have a baby who doesn't sleep very well. The difference between normal mom exhaustion and postpartum depression exhaustion is that while a healthy mom feels exhaustion, she gets up and is motivated because of the love of her child and the joy that she feels when she sees her baby and takes care of her baby. A depressed mom lacks that motivation. It's not there. She doesn't have it. She may feel disconnected from her baby. She may have not like been bonding with her baby. She just that joy that is there as a mother isn't there for the mom who's depressed. And it's not that she wants to feel that way. Again, nobody wants to be depressed. It's not like you grow up and you think, I hope when I am pregnant, I get postpartum depression. Like, nobody does that. Nobody wants to feel that way. So if you have a friend and you notice that they are always down in the dumps, they are always feeling anxious, especially if they can't control things, they seem angry, you need to say something gently. It's not a fun conversation to have. I had to have it with Laura. Or maybe I made my mom have it with Laura. I don't remember. But Laura says, yep, I remember locking myself in my closet and sobbing while I thought that my family would be better off without me. Guilt to the extreme. And that's true. That's what happens. You feel guilty all the time. And you just walk around with the weight of the world on your shoulders and feeling like the world would be better off without you. Which is very sad. It's a very sad thing. Another symptom that moms can feel, or another, they can experience are panic attacks. I never experienced a panic attack, but postpartum depression can result in panic attacks. There are appetite changes that also come with postpartum depression. Either your stomach is in knots and you feel nauseous and you can't eat, or it's the opposite. You feed your pain through food. And who has done that here? Me. That's why I'm in this place. I eat my emotions. It's what I do. I do it very well. And then the last symptom that happens is worsening depression. So you may realize that you are already depressed. You may be a mom who experienced postpartum depression with one of your pregnancies. And so basically the depression just continues to get worse until you get to the point where you experience a severe bout of postpartum depression. I just totally lost my train of thought. And as far as like it's any kind of abnormal feelings or behaviors. So you should be able to fall asleep easily. Laura's saying that she was exhausted, but she had a really hard time falling asleep. That's not normal. That's not a normal feeling. When you're exhausted, your brain says, okay, it's time to go to sleep now, so we're going to go to sleep. But a depressed brain, that connection it's missing. It's not there. There's a break in that bridge that passes, the neurotransmitters pass, messages across. But it's broken. And so that's why I think the important thing that you have to remember is to talk about these symptoms. Share this video with those of you who are pregnant and watching this. Share this video with your partner so that they are on top of things and aware of what the symptoms might look like. If you experience the baby blues, recognize that it's the baby blues and recognize it for what it is. If it lasts beyond 2 weeks, immediately go in and talk to your doctor. They take this very seriously now. It's not like in the past. I actually spoke at a women's event a few years ago and talked about my experience with postpartum depression. And this woman came up to me afterwards. She had to have been like in her 60s or her 70s. And she thanked me for talking about it. And she said, I had postpartum depression as well, but I had it during a time when you didn't talk about it. And it was a shameful thing. And so she suffered in silence. The hashtag for postpartum depression, one of the hashtags is you are not alone. And I think it's break the silence is the other hashtag. And so that's what this is all about. This is all about, getting the courage to talk about things and to kind of step out of ourselves and be that generation of moms that makes a difference, so that this disease doesn't take any more lives, either by physical lives or just life in general. I mean, being depressed sucks the life out of you, literally. You just don't feel any joy at all, and it's not pleasant. And so we just, we're not, if you have heart disease or if you have cancer, you're not ashamed of that, and you'll tell people that. But so often, and I remember this too, I don't take myself too seriously. I don't know if you figured that out yet. I'm pretty much an open book. And when I was depressed, admitting that I was, depressed and that I had been diagnosed with depression wrecked me to the core, until I got on antidepressants. And even then it takes 2 or 3 weeks for you to experience the full effects, of the medication. So, there's so much shame associated with the disease, and it's unnecessary. And I think we just hold ourselves to this very high standard as moms. But we're people too, and we need to be taken care of. You can't take care of your family, and you can't take care of your baby if you aren't healthy. And that's the truth. So another thing I wanted to talk about was the postpartum depression documentary, When the Bough Breaks, a documentary about postpartum depression and anxiety, is going to be available on Netflix May 6th. I'm super excited about this. I haven't actually seen the film. I'm just really excited about it. But it is narrated by Brooke Shields, who was diagnosed with postpartum depression in, I think it was like in the late 90s, early 2000s. And yeah, I'm really excited. I've been in touch with the producers of the film and just their passion for what they're trying to do, the awareness that they're trying to spread. Like that, this is giving me goosebumps talking about it too. Yeah, it's amazing. So I'm so excited that it's available on Netflix, and available for the whole world to watch. So I think it's definitely something that is important for husbands, baby daddies, fiancés, anyone to watch. Because like I said, the more people that understand what this disease is, the better we're going to be at recognizing it and diagnosing it before it gets to be too much. Marnie is saying that she has watched the documentary and she said it's amazing. And I'm so excited to hear that. That makes me happy. So yeah, so if you are watching this, and understand too that, when you go on antidepressants, it may not work the first time and you may need to figure out a different course of action. That's happened to me. I've had to up my meds. And every time it happens, like I kind of get sad about it, but that's usually because I'm depressed at the moment. Because now, like, I can talk about it and I'm not embarrassed by it at all. So, that is just what can happen. Ooh, the sun went away and I have lights on me and they're very bright. I got fancy lights for doing lives. What do you guys think? Do you like them? Sorry. Okay. Yeah. So definitely check out When the Bough Breaks, a documentary about postpartum depression. It is not the film. There was a movie that came out called When the Bough Breaks, and it's about an affair, an extramarital affair, and that is not the same movie. So make sure that you guys watch that for sure. But if you haven't talked to a friend of yours, and you think maybe if she's been on your mind, on your heart a lot, why don't you reach out to her today? reach out to your mom friend. Tell her you're thinking about her. Ask her how she's doing. You never know. She may be struggling, and she may need somebody to reach out to her. That's the other thing with postpartum depression. A depressed person tends to isolate themselves from everyone around them, which is all the more reason why you, the supporter of the postpartum or the depressed person, needs to actively reach out to them and show them that you care and that you love them and that you are there for them, and that you will come and just sit with them while they cry, and you will say nothing if they don't want you to say anything. You will just exist and be in the room with them if that is all that they need. So that's your homework for today. Your homework for today is reach out to a mom friend that you have not talked to, especially if she's a new mom. If you feel like maybe you're still experiencing symptoms of anger, long-lasting anger, depression, especially that hostility toward your baby or unexplained anxiety over your baby's health. Pay attention to those feelings. Talk to a loved one. Ask them what they think, and maybe be okay with going into the doctor or midwife or general practitioner, gynecologist, whoever you see. Make sure that you speak up. Don't try to fix postpartum depression on your own. Get some help. You don't have to go on medication always. You should do talk therapy if you're not going to be on medication. And, you know, I will say that I am on medication. I've talked about how I don't have a problem with medication, and I don't want to be talked out of taking it because it's a choice that I've made. And the same goes for you. Maybe you don't want to be on medication. And if that's the case, then you need to talk to your doctor or midwife about ways to naturally help relieve postpartum depression symptoms. You're going to have to be very diligent, I can tell you that. Really on top of things. And I say that because with most natural remedies, you have to use more of it to be consistent. You can't just, you can't just forget about it. You can't just decide like, okay, I'm going to work out today and then I'm never going to work out again. And I'm going to hope that fixes my depression. It doesn't work like that. So there are a number of ways to relieve depression. You don't have to use medication if you aren't comfortable with it. I just want to encourage you to talk to a psychologist, a counselor, somebody who knows what they're doing, which is not me. I just have the experience of it. I don't really medically know what I'm doing. So, yeah, and Ashley Freeman says there are so many tools to help with mental health. Medication is just one way, and that's true. That's so true. I have a lot of friends who experience postpartum depression, and they are not on medication, but they handle it other ways, and it's working really well for them. So you need to understand your body, know yourself, and be open to a lot of different options that you have. So I need to take another drink of coffee. My dog makes me want to curl up with her. Look at her. Isn't she so cute? Oh, Julie. She's so sweet. Chula. She's like, seriously. So, and Tiffany says, medication definitely helped me, but talking to other moms also helps. helps to know you are not alone and there is no shame in needing help. And that's true. There's no shame in needing help, and you aren't alone. Like I said, 1 in 4 women have postpartum depression. So if you have a lot of friends who are women, chances are you know somebody who has postpartum depression. It's just the way it is. But let me check the time. I should probably get going. It's been lovely, as usual. Sorry for the kind of heavy topic, but it's important. So what's your homework? Do you remember? Your homework is to reach out to a girlfriend of yours that you haven't talked to in a while, whom you've been thinking about, and she's been on your mind and she's been on your heart, and you're like, I don't know why. Maybe she needs to hear from you. So reach out to her. Tell her you're thinking about her and you love her. Ask her how she's doing. Maybe call her on the phone. Shocker. Sometimes calling people on the phone means more than texting. Newsflash. Just saying. And if you think that you might be struggling with feelings of postpartum depression, talk to somebody that you can receive support from. So maybe talk to your friend, family, partner, anyone. And then take the necessary steps to get help. So that's what I have to say about that. Watch When the Bow Breaks, a documentary about postpartum depression on Netflix this Saturday, May 6th. That's when it's available. Everywhere. Well, I don't know if it's like everywhere, but I know it's everywhere in the US and Canada. So, thanks so much for joining me and watching and chatting with me. I will talk to you guys. Actually, you know what? I'm not going to be able to talk to you guys next week because I'm going to be at Mom 2.0 Summit, which is a huge blogging conference in Orlando, Florida. I'm going to be there next week. So maybe you'll see Laura. Surprise, Laura. I haven't talked to you about this. We'll have a show. Same time, same place. Yes. So you guys have an excellent rest of the day. And Marnie just said we are going to crash Netflix on Saturday. Yeah, we are. All of you, let's break Netflix trying to watch the documentary. Getting all of our friends and family to watch it as well. Break Netflix. Okay, I'll catch you guys later. Be sure to be following First Time Mom on all of our social media channels. It's First Time Mom MN, like Minnesota. The blog is firsttimemomMN.com. And yeah, we have a lot of fun stuff happening on there. And I will for sure be doing some live shows while I am in sunny Florida, which I'm super excited about, and I should probably start preparing for, but I probably won't until I leave on Wednesday. So I'll probably pull an all-nighter on Tuesday. Just being real. So, okay, have a great rest of your day, and I'll see you guys later. Bye.